Hi guys, my name is Danae Smart. I'm a fourth year medical student at Loma Linda University School of Medicine. Some of you may know me from my previous videos, but this video is to just give some tips on how to be successful during third year. And what makes me qualified to give these tips? I'm graduating in May. I matched at University of North Carolina, Chapel Hill in family medicine. So I've been promising some of my friends going into third year that I'd make a video. So hopefully it will be helpful for you as well, even if you don't attend Loma Linda. So first things first, if you don't have a planner or an agenda book, you guys know how I feel about organization. So I would recommend getting one. And prior to each rotation, I would recommend looking at what assignments are due, writing that down in your planner or putting it in your phone calendar, and also going through the resources you're going to be using and planning out how you're going to study. So resources that I liked during third year were UWorld and Online Med Ed. Some of my classmates really liked Anki. I just never got into Anki, but if you like Anki or flashcards, that's a good option. So Anki Dex had like OME, UWorld, and other content in there. So I could see where it would be beneficial, but you have to choose your study style. And then of course the textbooks that are required for each rotation. So for example, for internal medicine, our clerkship director wanted us to read Step Up to Medicine, for Peds, Board Review Series, and for OB-GYN, I can't remember the name of the book, but it was helpful, and it was also good for us when it came to our quizzes because our clerkship director took quiz questions from content within the book. You can try to see if there's anyone who's taken the rotation before that can just pass the book down to you so you don't have to go into debt trying to make sure you have all these resources. So next I want to talk about actual clinical rotations. So I would recommend getting there. If you're supposed to get there at 5:30, maybe try your best to get there at 4:30. I know it may seem crazy or hard at first, but one, you want to give yourself enough time to see your patients, especially starting out. And this is just for the beginning, because of course, as you become more efficient, you don't have to go in that early. But I would get there at a decent time to make sure you have enough time to talk to your patients, do a good physical exam, and then also when you're pre-charting, making sure you're looking up anything you don't know as you're pre-charting, look it up. UpToDate is a great resource. Some of you may have other resources, but make sure you can answer your questions because the questions you have are probably the questions that your attending is probably going to ask you during rounds. A lot of people like to say pimping. It does happen. So for those of you that don't know what pimping is, it's just, being asked certain questions during your rounds or rotations by your superiors. Know why your patient's being treated, what they're being treated with, know the medications and the side effects. And also, if you should know some alternatives too, like sometimes they can ask you some alternatives. The next tip would be Step 2 CS. So this test is no longer something that you guys have to worry about, but this book will help you with your OSCEs. So for example, on internal medicine, we had a practice OSCE before our real one, and they gave us the 3 scenarios we might have. So like if we had abdominal pain or chest pain or right upper quadrant pain, like you can literally use this book because it has prompts. And let's see. So let's give you guys an example of what the book has in it. So here's an example. Kelly Clark, a 35-year-old female, comes to the ED complaining of headache. It gives you the vital signs. It gives you the little prompt you'll get in front of before your OSCE. And then it also has some challenging questions for whoever's working with you. So I would partner up with a friend and ask them to hold the book and check off as you go. So for example, you'd say, hey, my name is Dr. So-and-so. I'm here to help you. What brings you in today? And then they'll say headache. And then you ask when it started, the frequency, progression, severity scale. If you miss a question at the end, your friend can literally be like, hey, you missed this question. You didn't ask about visual changes. You forgot to ask about past surgical history, because it has all that in there, and it has some patient responses. So even if you wanted to do it by yourself, sometimes I had to do it by myself if my friends are busy or studying, on a different study schedule. So I really liked this book. And then you can put differential diagnosis in, and then it also gives you their ideas or their differentials. So like they put migraine headache as a differential, tension headache, and intracranial mass lesion. And then for diagnostic workup, they recommend doing CBC, CT, LP, CT sinus. And then there's another page with case discussion as well. I don't know if you guys could see that well, but definitely I recommend this book for your OSCEs. So I would get it. Okay, and last tip I want to give you guys is when you're presenting, make sure you are presenting in a logical order that flows, and you can keep it consistent. Like, you only need to adjust when you notice the attending either doesn't want a certain amount of information or you notice they want more information. So I always got comments on my presentations as well, like attendings would say present the intern level and stuff like that, which was really nice because I was only a third year. But it's because I just followed the order of introduction, Mr. X, Y, and Z, with past medical history, blah, 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 is presenting with X, Y, and Z. Then I would move on to subjective. Overnight patient reports, no headache, however, new onset nausea. Nursing said patient was tachycardic a few times overnight. On review of systems, blah, blah, blah. Next, you go to vitals. So you say the vitals, pertinent vitals. Then you go to physical exam, pertinent physical exam findings. You go through the lab. After labs, imaging. So if there's no imaging, just say no imaging or no new imaging. And then go to your assessment and plan. So it's always like you're following this order, which the attendings really like because it keeps everything in track. Make sure you're intentional with your plans because we have our resident to answer to and our attending, but one attending, I remember, I think it was my first rotation, I was saying my plan, I was like, I think we could do this, and the attending was like, if you're a patient, what do you want to do? And I was like, oh. So when you really think like that, like this is my patient, what am I going to do? It does help your rotation. You have a little more fun, and I feel like you take more accountability and responsibility, even though you are a medical student. So that's definitely a tip to really intentionally make your plans and tell yourself, these are my patients. Like, what do I want my patients to look like, or what do I want their outcome to be? Another suggestion I would say is to look at residents. So sometimes I would see how the attending feeds off of the resident presentation. And if I think that the attending really likes that presentation, I would try to mirror that resident. I also wanted to talk about evaluations because that's a big part of our requirements, like getting evaluations. So one tip for evaluations would be to go in and upfront tell the attending, like, hey, do you mind giving me feedback as we go through this week? Because we do have evaluations that we're required to get done, and I would like you to be an evaluator for me at the end of this rotation or at the end of this week or these 2 weeks. So that helps your attending, one, know that you're interested in getting feedback. They know that you need an evaluation, so they will be listening to you when you present and paying more attention. So definitely recommend that. Of course, you need to do it in a polite manner, but yeah, just hint them, hey, do you mind giving me feedback throughout this time? And then hopefully they'll give you the feedback you need, and then your evaluation will be great. Pro tip, do not do this just for brownie points. Do it because you really want to make someone's day. After my rotation, if there were residents that I really enjoyed working with, I wrote thank you cards. Like I went to the Dollar Tree and I have thank you cards in my backpack, so I could literally just write thank you cards. So like for Peds Neuro, I loved my residents, so I got them all chocolate and wrote them a thank you card. I've written attending thank you cards, and not every attending, of course, and it's not because I didn't want to, but sometimes I just didn't have time. Like on family medicine, I loved all my attendings and wish I could have wrote them all thank you cards, but I didn't write any because yeah, just time crunch. But yeah, thank you cards mean a lot to residents and attending. So if you can, I would recommend that as well. But like I said, it's not going to get you a better eval or anything like that, because most of the time, the people who I gave thank you cards weren't even the people that were doing my evaluation. If you watch my video, I believe it was my second year video. During that time, I had lost my grandfather. Well, during my internal medicine rotation, I had lost my grandfather, and I didn't really feel ready for my shelf, but I took it anyways and missed the pass by 1 point, so I had to redo it later on third year, and I ended up passing. But reflecting, I definitely shouldn't have taken that test. And I did reach out in my clerkship and didn't really feel heard or supported. So I kind of let it go and was like, I have to just man up and take the test. And it was just a lot of stress that I didn't need to go throughout the year if I would have just, spoken up for myself a little more and maybe said, hey, I can't take this test right now. So if you lose a family member or if you have a mental health concern, make sure you let someone know. Because that was a really tough period for me. I told you guys my Achilles was injured. I had left internal medicine some days crying on the rotation because of how much physical pain I was in. And then my grandpa, halfway through, I got a call that he was intubated and put on mechanical ventilation. So that was stressful. And then 2 weeks later, he passed away. And then going all the way to Florida for the funeral and everything was tough just because that's when everything really hit me. And then I literally came back on Tuesday and had to take the test Friday. So it wasn't a good setup for me. And looking back, I'm like, yeah, I definitely should have, went to the dean's office and explained how I was feeling and everything. So I just want to encourage you to advocate for yourself and also let you know that failure does happen. And guess what? You overcome it because I overcame it. And I know you guys remember my very first video about my journey to med school. So I just wanted to let you know I'm here. I made it. Med school has been amazing. I was a really competitive applicant. I wish I could show you guys my CV as well to show you all the things I've been involved in medical school. But this is just to let you know that even if your path was untraditional, guess what? You may come out stronger, more confident and more faithful. And I believe that's what happened to me. And I'm here today. It's going to be Dr. Smart in May. Hey. So yeah. I hope you guys enjoyed this. Hope it wasn't too long. Good luck in third year. Good luck in fourth year.